Good day, everyone. I am Basilio Ceniza Jr. with my study entitled Post-Intramedullary Nailing Osteomyelitis among closed femoral patients from January 2015 to December 2020 in Northern Mindanao Medical Center. The main objective of this study is to determine the demographic, clinical, bacteriologic profile, and management protocol of post-intramedullary nailing osteomyelitis patients admitted from January 1, 2015 to December 31, 2020. And here are my specific objectives. This study is descriptive cross-sectional case series in nature, employing review of records. The study population included those patients chart only from the period of January 1, 2015 to December 31, 2020 in a patient who underwent femoral intramedullary nailing in this institution. Descriptive statistics were instituted to the collecting data frequency distribution and simple percentage were utilized. The following are the inclusion and exclusion criteria. The following are the results after comprehensive data review. This data shows that the age of the patient was distributed from the age range 18 years old to 65 years old and above, with 45% coming from 18 to 25 years age group with a male predominance. For the clinical profile, the table shows that the laterality of fracture, about 60% of the cases, were on the right side, while the remaining 40% on the left side. None of the cases were bilateral. This table shows that the most fractures of the cases were located at the middle one-third, about 80%, proximal one-third, about 15%, and only one case located at the distal one-third of the femur. In terms of fracture classification, over half of the patients were transverse in configuration, about 55%, comminuted, about 25%, oblique, 15%, and segmental, 5%. In terms of wound classification, type 0 with a combination of 40%, type 1, 30%, and type 2, 25%. About type 4 combination, about 5%. For clinical profile, in terms of mechanism of injury, most of the cases were caused by a motor vehicular accident, about 90%, and the remaining cases were caused by fall, about 10%. This table shows the prophylactic antibiotic was given 30 minutes before the procedure, and it was shifted from zipazoline to cefuroxime postoperatively. And all of the patient underwent open reduction and intramedullary fixation were done using either lock nail or contour nail. The majority of the cases were performed by second-year orthopedic residents, where blood transfusion necessitated mostly 2 units of packed RBC, with the length of procedure were performed average about 3 to 4%. This table shows the case's blood transfusion was given about 3 units packed RBC, given to 60% of the patient. About 2 units was given to the remaining 40% of the patient. Almost half of the patient, about 45%, average blood loss about 800 ml, and the equal number of the patient at average blood loss of 1 liter. This table showed the majority, comprising 85% of the patients were classified physiological type A host, 15% were classified as type B host. Lastly, the type of microorganisms isolated from the patient were mostly gram-positive, about 60% of the patient, with a representative of organism of Staphylococcus aureus being the most abundant isolate based on culture and sensitivity testing. In summary, overall, from 581 cases of closed femoral fracture studied, about 20 cases, 3.4%, were identified to have a complication of osteomyelitis. 3.4% infection rate is slightly higher than the reported infection rate after fracture fixation in developed countries and approaches infection rates for open fractures. However, in this hospital, the infection could be attributed to the long time period before the primary nailing procedure, which lead to some soft tissue contraction and abundant callus formation. It's thus more complicated surgery with increased operative time and blood loss. Thank you.